guys, whether it's pain in your neck, back, arms, or legs, a lot of people just deal with the aches as a part of life. But you can live pain-free, and Sean explains how.
That's your special spot, isn't it?
Oh my gosh, you found it.
A lot of patients are told they have to learn to live with it, or told that there's no hope, and that's not necessarily true.
Dr. Devin Luzad has spent his career helping people live pain-free, something Rob Popovich knows firsthand.
I had a couple events, even since I retired, and immediately in my back I get swelling.
That swelling has had a profound impact on Rob's leg.
The pinching of the nerve that's causing the loss of control, the loss of strength, and everything else.
Rob turned to Dr. Luzad and the NUCA procedure, which Rob says has made a big difference in his well-being.
Within 4 or 5 days coming every day, I can be back walking pain-free and symptom-free.
The NUCA procedure, it's a very gentle approach to realigning the entire spine and getting pressure off the nerves. So when someone has numbness, burning, pain in any of the extremities, after a period of time they can not only get relief but start to get function back, so they're walking, running, doing activities again.
And the NUCA procedure is different than other chiropractic treatments.
No twisting or popping. It's a very gentle procedure and what we would call very specific. So when I take the digital x-ray, it's going to show me the exact angles to adjust the spine at, so that there is no pressure and there is no pain felt by the patient. It's just a gentle alternative to standardized chiropractic.
But before Dr. Luzad can start to fix what's wrong, he listens.
I had lived with pain for years.
Renee and her husband Dean came to Dr. Luzad for different issues, but found the same attention and care.
Coming in for our initial evaluation, he talked with us about, what we want. My hip was bothering me, and for us to be able to travel, and it was so important. And I could tell that he really cared.
Yeah, we're going to listen, and I mean truly listen. The days of a doctor just running in, reading chart notes, and running back out, those are long gone. They never should have started. So it's interactive. I need to know everything that my patients have been through, and we want to set goals. I want to know that this is working if we decide to work together. So we set goals as far as when they want to get back to work, what they want to go do for travel, even things like holding their grandchildren longer. That's what it's all about, not just getting relief, but getting your life back.
And getting your life back, living pain-free. It all starts with one thing.
The 2-day workup is a big key to our success. Helps me see who I can help and who I can't. So normally we charge $180 for it.
You have the chance to live not only the way you want, but the way you should.
So helping people and their families and the community is my mission.
I've been coming to Dr. Devin for probably about 4 years. I saw Dr. Devin on TV while I was getting my nails done, and he was saying, "Oh, do you have this? Do you have this? Do you have this? Do you have this? Do you have this?" He was naming all of these things, and it was me. Life was unknown before. I didn't really realize how bad my back was. I had x-rays before, but then I had a horse accident, and that was the catalyst that kind of made everything fall apart. I don't have any cartilage in C3, C4, and I don't have any cartilage in L3, L4. So when my back gets out of alignment, it pinches nerves, and nerve pain is pretty awful. You are just mentally exhausted from this pain that just seems to go like this all day long. And at times, I cry.
So on Jeannie, we want to be really, really safe and really, really careful and gentle because of the damage in her spine. So we prescribed a plan that was gentle adjustments on her neck, gentle adjustments on her low back, and then we worked on all the muscles around and the scar tissue so that she would hold her adjustment longer and longer, didn't have to come back to the chiropractor all the time. Anytime we lose quality of life or are dealing with pain every day, it's tough on not only our emotions, but the people around us. Our health affects everybody. And when people just try to learn to live with it, not only does their condition usually get a lot worse, the people around them have to learn to live with them. So when I help Jeannie, I'm helping her husband, her family, and all the people in the community.
It took a little bit of time because I was pretty, tied up when I first came. But I mean, there's times when he adjusts me that happens like that. It's that quick. And then I just don't want to move because I don't want it to go out.
So our patients would say we don't twist or pop. It's a more gentle method. It's non-manipulative. So we use the NUCA procedure. We use the arthrostim, which is just a very gentle tapping to the neck or the back. And that's a great way to align the spine without worrying about causing injury. We're not correcting a spine back to they were when they were 20 years old. What we're doing is we're moving things millimeters, but it only takes the weight of a dime to put pressure on a nerve. So when we adjust a patient, it can help with things like numbness, burning, tingling, weakness anywhere throughout the body, damaging effects of pinched nerves.
It's almost like a relief when he adjusts. I can feel it like that. It's amazing when it happens. It really is.